So welcome everybody. You've probably seen from your programs that we have quite a significant slot of time here to really draw on a lot of points that we've heard from this morning. We're going to sort of revisit some of the technologies, core ingredients, core multi-mechanism ingredients, and that's really a key phrase that I'd like you to keep in mind when we walk through the brand. But before we really dive into what are we going to use, how are we going to combine it, are we going to do pills, are we going to do products, we really need to understand what's going on with the skin when it ages. I know for many of us in the room, the concepts that I'm going to cover here will be revision, but it's crucial that we really understand what's happening with somebody's skin when they're sitting in front of us so that we can try and formulate the best possible treatment plan and products. The good news is, however, that Neostrata brand, you can have complete confidence in the level of science and the heritage behind the research. Things are evolving, things don't stop evolving. We're looking at 30 years worth of research here, which is really exciting, and I'm sure that the best is yet to come. But if we don't fundamentally understand what's happening in skin, we can't necessarily go about selecting the right ingredients, okay? So in terms of my declarations of interest, Lorna's given me a very gracious and very kind introduction, but just to elaborate on a few aspects, I do work very, very closely with the Aesthetics Source team. Neostrata as a brand is very, very close to my heart. This is a brand that I train with, I use in my clinic, and I've seen the results firsthand of what the products and what the pills can do in synergy. And it's a great pleasure to share with you later this morning some of the results that I've seen firsthand from my patients without any other modalities. Okay, so that's important just to keep in mind. I do take training very seriously, as I say, have different editorial positions, and I like to share my experiences with products and teaching as widely as I can. So I've added in here a couple of references from some papers that I've written. One is in conjunction to my experience using the retinol peel from a clinical case study that we did. And I also wrote up some experience that I had using cosmeceutical products from the Neostrata range in conjunction with the anatomy of the skin and the aging skin very specifically. So, historically, it seems that Rembrandt had a bit of a fad for the Neostrata range as well. Who knew it, right? But on that note of anatomy, I don't want to spend too much time on this slide. It's beyond the remit of what we're really here to talk about today. But this slide tells us some very key, powerful messages about facial aging, which really, if we negate even mentioning, we are missing a trick. Obviously, the focus on my talk really is to look at the aging skin and what we can do to give it almost like a superficial plumping and volumizing effect. But as you can see here, when we think about, for example, the face and the neck, we can actually understand now and appreciate that the facial aging process is complicated. There's a lot going on. At the deeper aspect, we know that the facial skeleton, for example, undergoes a profound bony remodeling process. There is seminal work about all of these aging processes that I'm going to talk about. As I say, I'm not going to dwell on these too much, but we need to understand what's going on. If we think about the face, again, and certainly the skin, in a three-dimensional way, there's a lot happening here. We know that the fat changes, the fat can age, the muscles start to atrophy and become weaker. The skin is no exception to that, and we're going to dive into that in much more detail. And it's multifaceted. It's the most important point here. So we need to keep those things in mind. Of course, we know there's a huge amount we can do in terms of improving and rejuvenating skin, but we also need to keep in mind in our aesthetic practice that the products and the pills from Neostrata fit beautifully alongside any other anti-aging modalities we may be doing, whether that's lasers, whether that's RF technologies, or even surgical procedures. There is a place for these regimens. So, well, what do we know about skin? We know that it's widely regarded in the literature as a cutaneous envelope. It holds everything in place. It's a considerable major body organ. It has a huge role in the immune function of the skin. It takes up approximately 10 to 15% of our total body weight. It covers an expansive area of almost 2 meters squared at a depth of 3 to 5 millimeters. It really, really matters. It's a big deal. There's a lot we can do to improve the health of the skin and improve the overall cosmetic appearance of the skin, certainly. A couple of slides here, guys, just to think about what's happening. Lorna's already given us a beautiful overview of how the skin ages. I'm just going to take that and just go into that in slightly more detail. Okay, so we have new cells formed in the basal layer. We have the epidermis here. And we know that cells undergo structural change as they move to the exterior, which results in cell death and the transfer of the cells into keratin. Keratin, as we know, is one of the most abundant proteins within the epidermis, and by the time the cells come to the outermost segment of the epidermis, they have shed their nuclei. So this is the dead part of the skin. This is the part that we're going to think about when we talk about exfoliation and which products and ingredients throughout the neostrata segments are best to do that. The dermis. I'm assuming that many of us in the room are doing hyaluronic acid fillers or different types of injectable procedures, okay? We know the importance of this layer of the skin. We know the core structures that are here. We understand how these age. But as a quick recap, what we have is the ground substance, the endogenous glycosaminoglycans in skin. Hyaluronic acid is one of those which we know in a younger, more healthy-looking skin is there in abundance. But we know with age, of course, it depletes. We have various appendages. We have blood vessels, nerves, all arising from this structure. And beneath that, we have a subcutaneous layer of fat as well. For those of you in the audience who have a particular interest in acne and rosacea, this is a phenomenal text. Some of you may well know this or may well have this in your clinics already, but the histological images within this book are absolutely second to none by very, very well-respected seminal dermatology authors here. But these are some of the main structures as well that we can expect to see on the human face. So we've got the far hair follicle at the end hair, fine vellus hair, which is there in abundance on facial skin. The one in the middle, for those of us, again, who've got an interest in acne, it's a large multilobular unit. It's a sebaceous gland, okay? Secretes a waxy lipid-like structure, and we'll refer to this when we talk about the refined segment in terms of what we can do to control the amount of oil produced in this gland. And finally, what we have here on the far right-hand side is a terminal beard shaft, and you can appreciate the depth and the thickness of this follicle from the thickness of the hair that comes from this. And this is an area that we expect to see gland-wise that is abundant on men, okay? So skin aging. Now, Lorna touched on a really, really important point. One of the key things that happens, or one of the most significant structural changes that happens in aged skin, is this flattening segment between the epidermis and the dermis. That really, really, really matters. That's now been postulated as being one of the key factors in why we get lines and wrinkles on our face. An area often on your patients, and I won't even be age-specific with this because we know that biological aging doesn't always affect true aging in individuals, but it's been postulated that actually one of the areas that you can start to see that slight sheet-like separation or that shearing effect is actually on the neck and the anterior aspect of the neck, okay? We have a topical formulation, which I will come back to, which is absolutely phenomenal for treating the neck. That separation can also mean, or that flattening effect can also mean that vital oxygen, vital nutrients are limited in actually being able to pass through the epidermis to the dermis, as Lorna alluded to. There also comes a challenge then in the formulations and the ingredients that we apply to the outer layer of the skin in being able to actually be transported or stimulate an effect. So again, thinking about certain ingredients that we know can actually give us a nice undulating root ridge, glycolic being one of them, we're going to talk about others. We know that we can actually not only improve and exfoliate the health of all the cells in the epidermis, even down to the basal layer, and even the health of the basement membrane itself, which is that Velcro-like structure which adheres the dermal layer of the skin to the epidermis. We also know that the elastin within skin becomes almost elastotic in effect, okay? And that happens by different enzymatic messengers that stop the healthy production of elastin. It almost becomes coiled in lifeless bundles in skin. Glycolic alone, we know, is an ingredient from the resurface segment that can reverse that process and improve the quality of elastin no end. So what else can we see here? We know that, as we said, the amount of hyaluronic acid within skin hugely depletes as well. It's the most phenomenal plumping agent. We know it can bind its own weight in water by up to 1,000 times, okay? So with a topical regime of the right ingredients, there's a lot we can achieve, a huge amount we can achieve. We've all seen this image, okay? This gentleman, 69-year-old gentleman, a lorry driver from Canada. Bill McElligott, this was published in the Huffington Post in June 2012, but this shows us such a powerful message. This shows us on the right-hand side of his face is a lorry driver, the side that wasn't exposed to chronic amounts of UVA and UVB radiation. This shows us those intrinsic age-related changes that we've talked about already. We see the bony remodeling, we see the textural changes, the coarse, thick texture of his skin and the righties, which we know have a strong, almost biological, predetermined pattern with all of our patients. Of course, we know there are slight variations within that with different skin types, but nonetheless, that is predetermined. But look at the difference in this gentleman from that side to the right side, which was chronically exposed to UVA and UVB throughout all of his working years. That picture speaks that message so closely, and I think it's ironic that I've thrown this up here when it's actually Sun Awareness Week, okay? But nonetheless, it reinforces such a powerful message about thinking about what ingredients can we put on the skin to prevent that from happening, okay? I'd like to just spend a bit of time before we talk about SPFs, and certainly one particular formulation, our sheer physical protection SPF, and why we have such a unique formulation to protect against these wavelengths. I think it's important we just understand what we need to protect our skin against when we talk about UVA and UVB. UVC, as you can see here, this is not a wavelength that we need to be concerned about from the health point of view of the skin, or indeed the true age-related effects from this particular ray. UVB and UVA, as we know, this is a different story. UVB, or skin that's been exposed to cumulative effects of UVB, is strongly implicated with non-pigmented types of skin cancers. This is when your skin burns from accumulated time of sun exposure. This is the ray that's caused that effect. Even when the skin heals, the detrimental DNA damage to skin is still there. So UVB matters. It really, really matters in terms of thinking about the right ingredients to protect against the detrimental effects. I think the danger is because we think that it sort of penetrates and causes most of the effect in the epidermis, that it's not as detrimental, but really nothing could be further from the truth. UVA, as we can appreciate here, penetrates even deeper down into the midsection of the dermis, destroys collagen, targets and damages elastin fibers, and is strongly implicated again in types of skin cancer. So these all matter. So when we're thinking about advising our patients against antioxidant protection, the right type of sunscreen, UVA and UVB broad spectrum, this is what we're trying to protect our patient's skin against. Okay. Just a quick recap here in terms of what we're thinking about with AHAs. So those photo-age, texturally challenged skins that are very, very thickened from cumulative amounts of sun exposure. They're some of the best types that we can think about targeting with our resurface segment. How many of you in the room use a product from our glycolic and citric acid based line? Yeah? It's a hero line. This is a great first level AHA product line for thickened textural, very, very popular choice with gentlemen as well. For me, this is probably one of my favorite products within this brand. As Lorna reiterated, each segment within Neostrata does a very, very specific role. And within each segment, we have a designated cleanser to do a specific job. What we have here is our foaming glycolic wash. We have, as you can see, hopefully on the bottle, we have a 20 bionic AHA mix. So what we have is an 18% glycolic and 2% citric acid, also some lactobionic acid in here as well. But this is a phenomenal first-line entry-level AHA cleanser. Foams and can acclimatise patients' skins for various other treatments, but patients will notice very soon after they start using this, in some ways no matter how bad their condition of their skin is, that they actually see increased luminosity. Large open pores are a key sign of photo-age skin, and I think glycolic as an ingredient can refine the appearance of thick, textured skin beautifully. Combined with the added antioxidant benefit and humectant properties again of citric acid, we do get that added hydrating effect of glycosaminoglycans within the epidermis. So, as we say, one cleanser out of the entire resurface range. Consistently, what this line is designed to do is reduce the corneal site adhesion, modulate the desmosomal attachments at the lower levels of the stratum corneum. But as Lorna has alluded to, it doesn't just stop there. We know we see a stimulated biological response in the upper layers of the dermis. Neostrata have a plethora of single ingredient studies to show what these products do. proven with histology. So we know what we're saying is true, and you will see that very quickly within the first few weeks of your patients, even starting just on 1 or 2 of these products. So gluconolactone, one of my other favourite ingredients within the Neostrata segment. So this features very strongly within the Restore range. This is exceptionally well tolerated, and this is an ingredient which is recommended for use pre-treatment, often during aesthetic procedures, and afterwards as well. This is the key ingredient in the first step of our ProSystem pills, which we're going to talk more about as the day goes on, and you'll see a demonstration of this being used tomorrow. And as Lorna's alluded to, this is derived from the glucose of corn. Very, very humectant ingredient. We have 4 hydroxyl groups, but we also manage to achieve a very gentle and effective exfoliation. And in my practice, at least, where possible, I like to try and engage and discuss with my patients the benefit of using 2 cleansers. Just because the Neostrata segments are colour-coded to do specific things, it's not to say that patients need to stay on one segment to target something specific. We do have the flexibility and the option to be able to mix and match across the entire range. And very often, I like to combine this particular cleanser with something often from the resurface for a very high strength, high impact and gentle approach to treating skin to still get the exfoliating benefit. Okay? This has 4% gluconolactone in. It's a non-foaming cleanser. Have many of you guys used this cleanser yourself or sell this in your clinics? Yeah? Yeah, it's a great cleanser. Yeah, absolutely. Extremely well tolerated with the added antioxidant and elastase inhibitor as well. So you can also rest assured that, for example, thinking about treating rosacea skin where we have a real challenge. On the one hand, we're trying to restore the barrier function of skin, which this cleanser will do beautifully. But on the other hand, we still want our patients with rosacea to benefit from some sort of anti-aging mechanism, okay? Not just about restoring the hydration and not just about maintaining barrier function. We still want to be able to deliver elastase inhibition, so protecting the quality of their elastin fibres and also giving them some gentle exfoliation to keep that epidermal cell turnover, you know, as close to sort of 21, 28 days as possible. There are a huge number of seminal papers about what this ingredient does. We've looked at some of them already, but I don't think it's a bad thing to just revisit them and look at some of the findings from what these papers told us. This is a polyhydroxyacid gluconolactone protecting against ultraviolet radiation in an in vitro model of cutaneous photoaging. As Kathy's already mentioned already, the claims are made about the product always start with an in vitro study based on a single ingredient, often with a therapeutic strength of around about 8%. Before that product then goes into a combination of a multitude of other ingredients to see if it delivers what the product or what the research claim says it does. Okay? One of the key findings from this paper, which I think is very interesting, is that gluconolactone as an ingredient was shown to provide maximum photoprotective benefits comparable to vitamin C and vitamin E. I'm going to come back to antioxidants in a little bit more detail shortly, but vitamin C and vitamin E are very common ingredients used, and of course we know there are lots of different compounds and types of solutions of these. We have tocopherol acetate, various different types of vitamin C as well. Some are more photostable than others. But we have an ingredient here that, as well as doing all of those other multi-mechanism actions, also provides a maximum protective benefit as well as vitamin C and vitamin E. So many patients that we may be seeing or treating ourselves in clinic may already be on some sort of prescription strength topical treatment for rosacea. We know there's a great number of them out there. I think it's fair to say that metronidazole and azelaic acid are still very common and very popular choices supported by solid evidence, and that's fine. But of course we know that those modalities are designed to really treat the symptoms, as it were. Okay, we know that we can't cure rosacea, of course, but there is a lot we can do with this ingredient to actually reduce that chronic amount of redness. This study showed us that actually a lot of the erythema, the stinging that was associated with Finacea azelaic acid was reduced significantly by using a concurrent gluconolactone-based skin regime. So that's great news, isn't it? Because that means that patients can continue with their prescription strength regimen to treat their rosacea, but they also have the added benefit of knowing that they can actually have the barrier function restored. a lot of the dryness, the stinging, the hydration is restored to the skin. The impact on the quality of life with rosacea from targeting those things alone is really very significant and not something to be underestimated. And I will show you a case study of mine with rosacea that was based on purely the Neostrata regimen with adjunctive peels to show you how far you can take that theory. Photo-age skin, okay? I think it's a growing concern. It's something that I'm seeing a lot of in my practice, in dermatology and also within the aesthetic setting. A couple of things here really. We know that patients obviously are living longer, for sure. Lifestyles are busy, okay? People are spending huge amounts of time in cars, driving around. Their skin is exposed for longer periods of time, arguably, to just ambient daylight, which is incredibly destructive. So we also see, again, as another multi-mechanism aspect to what these polyhydroxy acids can do as a group, show a comparable efficacy to AHAs, but they're compatible with atopic and sensitive skin and can be used before and after cosmetic treatments. In addition, as we've seen, they can also be used with prescription therapies, acne and rosacea. So even individuals who may be on a prescription strength retinol would still be able to benefit from the hydration and the barrier reinvigoration, I suppose, from what the Restore segment can offer. We have the cleanser within the range, and then we have an assortment of day and nighttime options that are highly moisturizing and protective to skin. Guys, I've got some images in here that are my personal photos, so I have no issues whatsoever in people wanting to photograph the seminal work from Neostrata. But anything that comes up like this that's obviously a real person, do you mind just not photographing it, just because they've consented to have their cases and their skin talked about academically, but I don't want it to end up on social media where possible, if that's okay. So this was one of my ladies that came to see me in clinic who, as you can see from her baseline image here, had no previous treatments at all, had actually been quite shy and quite nervous about entering an aesthetic clinic to talk about her skin because she felt embarrassed, because it was having that much of an impact on her life and her self-esteem, I suppose. But as you can see here, this is a lady who's 59 years old. So the menopausal effects of skin, we know that the drop in estrogen in female skin accounts for a huge amount of the biological changes that happen, okay? Some very interesting work being done on that front, but that's beyond the remit of today. But thinking about what we can do to target that thick textural appearance of photo-age skin, we can see those established lines across the lip. Thick, large pores are such a classic sign of photo-age skin. Mottled appearance, a previous lesion removed here, a previous BCZ from the amount of lifetime sun exposure she's had. So she's absolutely somebody we need to engage with the importance of antioxidants, okay? The best ingredients to give antioxidant protection. And also uneven skin tone here and pigmentation as well. The melanocytic enzyme activity in skin slows down significantly in life just as a natural intrinsic biological process. So there is an argument to say that no matter how much sun or no sun we expose our sun-prone areas to, the overall skin tone and appearance will always change, okay, and always become, or even arguably more so in a female skin than a male skin. So this lady, we opted for the resurface segment, first line. I started her off on the foaming glycolic wash, because that's a thick textural skin that will be able to tolerate that. Again, we do have the amphoteric complex within that cleanser to reduce irritation, but that's what I would call a normal textured skin, that even just with the beneficial components of the glycolic and the citric acid would really reinvigorate that skin quite significantly. We combine that then with one of the daytime options within the resurface line, which is Ultra Daytime Smoothing Cream, which has an SPF 20 in as well. 8% glycolic acid and 2% citric acid. And this is still a work in progress for me at the moment, so I'm sorry I can't show you sort of the early effects from what that regime has done. But really just with those two products alone, she's very budget constrained. She called me within 2 weeks, delighted. Makeup's going on better, family, colleagues commenting on how well she looks. And it doesn't cost the earth. We are in an age now in the aesthetic sector, certainly the UK, where we need to get a Miller filler to treat everything, right? And, you know, price, you know, I'm sorry to say, but price matters. But again, thinking about how cost effective, dare I say, you know, this portfolio of product is, it does a lot. We're just talking about 2 products, okay? Some other features of photo-age skin here. This lady is actually younger, but I would say probably biologically, according to her skin, is older, okay? Very good lifestyle, believe it or not, but she will not stay out the sun, okay? I'm not even 40 and I've had 2 BCC, so I get it now, okay? But again, look at that thick photo-age texture, large pores, established lines, telangiectasia across the malar region of the nose. It's classic signs of chronic sun exposure. And as I say, I'm making this point because I think these skin types are coming in more and more and more into aesthetic clinics now, looking for multimodal approaches, peels combination with home care. And the neostrata segment is perfect in a lot of ways for these particular patients. We see that thick textural lines here. Toxin's not going to do much, okay? This is an image here that's almost at baseline, okay? It's not going to do a lot here. So let's dive into photoaging in a bit more detail than as a concept and really draw on the portfolio to think about what we can do to deal with a lot of these cellular changes, okay? Because I think this is something that really matters, and I think it's going to matter much more to us in aesthetic practice. This is one of the best papers that I can still find that talks about photoaging as though you're talking about your neighbour's business to someone on the bus, all right? I know that sounds crude, but it breaks it down into a really, really simple way to understand, because it is a very complex process, influenced by a huge number of external factors, okay? But this paper is fantastic. It really breaks it down into some sort of manner for which most people, would read and resonate with and understand what they would then do with that information to treat their patients. So we've talked about the chronic UV-induced damage that's strongly associated with photoaging, but it is now becoming more of an umbrella term which encompasses other concepts like glycation, which we'll come back to. But we see this dermal elastotic effect. What Neostrata have a fascinating study that showed that gluconolactone is actually able to inhibit the elastin promoter gene. So that really matters because in UV-induced skin, or skin that has a huge amount of actinic damage to it, that promoter gene is working overtime and causing a lot of the elastin fibres in the skin to lose that beautiful elongated appearance that Lorna showed us in those amazing histological slides. And it sits in lifeless bundles in the skin. And that, in a lot of ways, is what causes the skin to develop that very sallow and yellow appearance and a very mottled and thick textured appearance. MMPs. This is a really, really interesting area that's getting a lot of speculation and a huge amount of growing interest in terms of what ingredients can we use to stop the detrimental effects of MMPs. I will use that term MMP in a very broad, overarching way because actually the literature tells us to date there are at least about 30 different types of MMP reported. We're setting up and taking these guys very seriously now because each one of them, MMP 1, 9, 16, 24, target different types of collagen, type 4 collagen, in the basement membrane, type 7 collagen, in and around the basal cells. All of these types of matrix metalloproteinases degrade the skin in an aggressive way. Okay, so they matter. And we need to understand what we can do in terms of certain ingredients to try and stop the detrimental effects of these enzymes in skin. We know that their presence gets stimulated in the process of things like cigarette smoke, poor diet, UV exposure, UVA exposure principally, but there is a lot we can do. Certain ingredients like lactobionic acid, like maltobionic acid, which can actually protect the skin. We can't actually undo the detrimental effects of what MMPs have done to skin in some ways, like advanced glycation end products, but there's a lot we can do to actually protect the dermal matrix of the skin at high-risk individuals to stop the damaging effects of those enzymes in the first place. So this is a very hot and interesting area of skincare. For me, it's a great personal interest. There are some fascinating papers out there that talk about these enzymes in exquisite detail and what we can do to try and stop them from being aggressive and attacking the dermal matrix of the skin. Inflammation is another concept. We know inflammation per se is strongly associated with carcinogenesis, whether that's skin cancer or whether that's more inflammatory systemic skin conditions, but inflammatory infiltrates really matter, okay? It's a cascade that gets triggered as part of UVA and UVB exposure, sunburn, of course, huge amount of aggressive inflammation to skin, so it matters. And variable epidermal thicknesses. We've seen already the benefit of ingredients like citric acid and glycolic acid in terms of what they can do to restore the hydration to the skin, the amount of natural hyaluronic acid content. So there's a lot we can do to reverse, if not protect and prevent the skin from even encountering a lot of aspects from photoaging in terms of ingredients. I'm going to break this down and make this very, very simple. But when we talk about advanced skincare regimes, thinking about multi-mechanism ingredients like maltobanic acid and like lactobanic acid, we have to understand that these ingredients on their own play a huge role in protecting against damaging effects of glycation in skin. If we look at the quality of the skin in a patient, for example, with diabetes, even a well-controlled diabetic, as healthcare professionals, we are always concerned about the healing rate, on the quality of what that skin looks like. We tend to give that skin extra care. So there's an argument to say that anyone with like serum lipid levels with a high hyperglycemic state that's permanently raised is warning bells for us. But when we talk about glycation, to make it simple, what we're talking about is a reaction between reducing sugars, it's a non-enzymatic response, and certain proteins, okay? And in the skin, the proteins that we're really trying to protect and nurture as collagen, first and foremost, and all the different types of collagen we have in the skin. So glycation as a concept could be an intrinsic process, from somebody with an existing systemic condition like diabetes, for example. Or we could externally expose the skin to a lot of concepts which can trigger off a similar process in the skin. Cigarette smoke, diets in terms of foods that are fried, for example, or foods that are just simply have a very high refined sugar content, okay? Sugar has now become, which I think probably many of us will agree, sugar has now become the new tobacco, okay? It really matters, I think we now have a tax on, I bought a bottle of Coke, that's my thing, I love it, but it's okay because I have maltobanic acid, so it's a bit of a trade-off, so it's fine, it's okay. Right? Don't take me anywhere without my Coke. But no, I laugh because in the UK, I think there's sugar taxes kicking in now. The bottles of, drinks that we know have got like 2-3 tablespoons of Coke in them are actually getting smaller. So, yeah, I know, I'm mortified. But anyway, it matters. It really, really matters. And as I say, there's a growing number of literature out there that's looking at certainly the implications for skincare. What ingredients should we be using? People are really starting to sit up and listen and take this concept very, very seriously. Again, it's a personal interest of mine, but hey, it matters and it's out there and it's a very legitimate phenomenon. The reason why I've got this slide up is because we used to think that glycation was just a very separate phenomenon to UV radiation, for example. In 2012, and I've seen at least another 5 or 6 papers since this, we're now proposing or postulating that actually UV radiation can kickstart and play quite an intrinsic role in the glycation phenomenon. So there's an argument to say that inside the cell, all of these things are happening at once. So really, again, the importance of multi-mechanism ingredients to deal with all of this stuff really matters. But let's break it down into a very simple form. So here's the UV radiation, here's the sunlight, bouncing through the keratinocytes. Collagen cross-linking, okay, so this is directly in relation to the glycation. We see reduced elasticity, but stiffness. So the collagen cross-linking becomes far greater, if you like, but that maybe on face value sounds like a good thing, but actually it just means that the collagen actually becomes stiffer. And I think Lorna's analogy of that creme brulee concept is fantastic because there's no strength to that. You crack the top of a creme brulee and you're straight through the skin in some ways, okay? It's perfect, it's exactly what's happening. Fibroblasts equally are not able to synthesize in a healthy way, okay? So that really matters when we think about collagen production or collagen renewal. Here are these MMPs here being stimulated tenfold in the presence of UV radiation, ticking alongside the whole glycation process, alongside an elastotic effect, so the inelasticity, if you like, of the elastin fibers. I know it's complicated, guys, but it just reinforces to us the need to understand this and understand the place and the importance of multi-mechanism ingredients, okay? For any of you that are particularly interested, any insomniacs in the room that want to take the bedtime reading a little bit further, this is your opportunity. So this is the reference from where I took this paper from. It's a very, very interesting study, so by all means, take a copy of that if you wish. Okay? So, I talked about these concepts in a little more detail. This is a paper that I wrote, which was actually, to be fair, largely empirical, but this was a paper that I wrote for PMFA Journal. It's a great journal to access for you guys. I think Neostrata and Aesthetic Source have a regular place in that with a lot of advertorial, which is great. And I talked about a lot of these concepts in terms of what they do to the skin, a little bit more information out there in terms of understanding the ingredients and how we can use them to protect the skin. You can find it here. So let's talk about the lactobaric acid. So I've mentioned maltobaric acid as being a multi-mechanism ingredient, but let's not forget the others. Lactobaric acid has a very unique property to it that we haven't talked about just yet. This ingredient, aside from skincare, is a major constituent in organ preservation solutions. So thinking about different organ transplant centres that may be transporting vital organs from one centre to another, they will utilise this particular ingredient in their solutions because of its chelating properties against iron principally, and also its ability to give a very, very high, gentle and safe antioxidant effect. Okay? So it's got a very strong medical heritage to it in terms of what it can do, but it doesn't stop there. As we've seen already, this is a category of acid that has 8 hydroxyl groups. So we know as the number of hydroxyl groups increase, as does the humectancy potential. So if we come back to thinking about our photo-age skins for a second, and our skins that are just devoid of, lost a lot of their lipids and a lot of their nourishment, compromised, weakened barriers, this ingredient is absolutely perfect to restore the quality of the elastin, stimulate production of natural hyaluronic acid, and most importantly, try and reverse a lot of the oxidative damage that's happened in those types of skins. This also inhibits those MMP enzymes, okay, and forms a gel matrix for skin softness. And as I said, we do also get a fantastic production of glycosaminoglycans. Who's used sheer physical protection? Do you like it? For me, nothing comes close to this sunscreen. Not because it's cosmetically elegant, which it is, but because this is such a high strength and advanced anti-aging SPF that can be used post-procedurally. Again, I think we've got Professor Beth Bryden here who's done a lot of work with this particular SPF and using this after many in-house dermatology and aesthetic treatments. I've used this myself after a peel. This is the only, for me, SPF that I like to use after one of the Neostrata Pro-System peels. It has a universal tint to it as well, which means that you can comfortably use this product on clients of any phototype. Okay, and I have used this on individuals of a true phototype 6, and there is no, Amy's smart, yeah, do you agree? Yeah, it's a magnificent product, absolutely fantastic. But ingredient-wise, it's not just all about lactobaric acid in this SPF, okay? It's a zinc and titanium-based SPF, 50, okay? Exceptionally high levels of UVA protection. It's broad spectrum. We have vitamin E, obviously well-known, well-documented antioxidant. And we have another very interesting ingredient that has exceptionally high antioxidant properties called EGCG, which is green tea extract, okay? As an SPF, for me, nothing cuts the mustard like this, if you pardon my expression. I actually like to use this myself as a makeup primer, because you can layer a product on top of this. It's that fine. If those of you who haven't tried it, I'm sure we have some here, I'd strongly urge you to try it. It's magnificent. The only thing you've got to remember, you've got to shake it for a few seconds. Amy says, yeah, you just got to shake it for a few seconds, but it's magnificent, okay? So here you've got an SPF now, thinking again back to your photo-age patients. High risk, even patients with histories of skin cancer, they absolutely need to protect their skin, not just against UVA and UVB. They need to be protecting their skin against these horrible enzymes. They need the antioxidant benefit, and they need the moisture and the nourishment and the added hydration. This is just one example of a multi-mechanism ingredient and how it can work even better and amplify the potential of other ingredients that it's combined with. Okay. I love this slide. I know Lorna's drawn our attention to this already this morning. But this was an important study, actually, that was done in 2008, because this told us the potential of what lactobaric acid does as a single ingredient. Many of the studies that the Neostrata company have show the anti-aging potential and benefit of what this ingredient does alongside gluconolactone, for example. Okay? And these two feature quite heavily in combination within the Restore segment, for example. But this brown staining here on the top left-hand side as the baseline shows those keratinocytes, that protein within the epidermis, actually loaded with this type of MMP9. And this particular MMP loves collagenases, okay? So this one is all about wiping out and obliterating elastin, okay? Single ingredient, 8%, just a 12-week application. The reduction in the brown staining here from the right-hand side to the left is absolutely magnificent. And we see overall a more organised and uniform and viable stratum corneum, outermost layer, and a better undulating ridge here. A picture tells 1,000 words, and I think that shows the potential of what that single ingredient can do at 8%. So maltobionic acid, we've mentioned already, principally really only in its capacity to inhibit these MMPs, but again, it's a multi-mechanism ingredient. It's exceptionally gentle, okay? Unlike when you start using the foam and glycolic wash, for example, from the resurface segment, you find you get a transient, but a mild tingling with that, despite the amphoteric complex. With this ingredient, this has been shown, I think one of its strongest points is that we can still deliver a very advanced anti-aging effect, as we've said, on a number of different levels, but it's exceptionally gentle and well tolerated. So this, even around the eye area, okay? It's a foaming cleanser, and this has a combination of the gluconolactone and maltobionic acid. Probably one of my best-selling cleansers in my own clinic. I like this as a nice entry-level cleanser. It's great for preparing skin prior to treatments, very well tolerated, very popular product. Not only because it also helps to reduce UV-triggered melanin production, and as we've said, we have this non-irritating and gentle exfoliation from this ingredient, again, because we have 8 hydroxyl groups. Very, very humectant and hydrating. Okay? So let's just look at the study where we've based some of our findings in terms of maltobionic acid. Again, this is an ingredient that was looked at 8%. So we've taken the in vitro findings and now presenting at AAD in 2006 to see the effects of what this ingredient can do. Now, let's just revisit the eye area again. And as Lorna rightly said, for those of us that do injectable treatments in the audience, treating that very mild early eyelid skin, that mild laxity, you're not going to get very far with toxins. Okay? You need to be thinking about a high-strength anti-aging regime around the eye area, topical ingredients, peels, and so forth. Can achieve this at just 12 weeks from a single ingredient. Okay? Who's used intensive eye therapy? Yeah, for me as well. I would not be without it. It's my desert island product. So for those of us that know this product, it does what it says on the tin. I've never, ever found a better eye product to this day, and I say that with, being very candid and honest. Absolutely phenomenal product, and unlike a lot of eye treatments out there or eye products out there that are really indicated for the sort of the inferior aspect of the eye, this product is designed to be used over the entire lid, okay, all the way up to the lash line and the brow line twice a day. You'll notice, for those of you that don't know this product, or maybe those of you who have observed or used this already, that the thickening effect that you get with your skin at the lateral canthus here, just at the side of the eye, is just remarkable, okay? My toxin now lasts about 12 months. I've had it for a long time, okay, so I have to take that into account, but it lasts a long time now, and I'm convinced it's because the quality of the skin around my eye area is much stronger. Certainly when I do a pinch recoil test, which I like to do with a lot of patients in clinic to see how inelastic their skin is, this is my go-to product. And that pinch recoil is better and stronger and firmer. Okay. So what's going on beneath the skin? Profound epidermal thickening. And as Lorna's alluded to already, we see an absolutely beautiful and more viable and more epidermal reduction in over-keratinization, but a nice, safe, gentle exfoliating effect. Okay. So if we think about multi-mechanism again, neoglucosamine or N-acetylglucosamine takes that concept, in my view, to another level. This is a non-acid anti-aging amino sugar. Kathy's given us a beautiful context of how these ingredients have evolved and where this sits in the history and the heritage of the Neostrata brand. This is a phenomenal ingredient that has the potential to often amplify other ingredients that it's combined with, for example, retinol. It has tyrosinase inhibition properties, so it features very heavily and very strongly as a core ingredient within our Enlighten segment that we use for pigmentation. And as you can see here, I've added 2 other products, one from the Skin Active range, which is the triple firming neck cream, which I mentioned in terms of treating that early skin laxity and mottled skin textural appearance. And we also have sheer hydration here, okay, which was our daytime product from our Refine range for oily and acne-prone skin. So why have I got all these different products up, and why am I mentioning all of this? Because, as I've said, this product is capable of delivering a lot, and it makes a strong presence across various segments of the entire portfolio, okay? It reduces the pigment production and gives a very gentle exfoliation, as we said, through its tyrosinase inhibition properties. And it's great for oily prone skin through its exfoliating benefits and also its exceptional gentleness. It's been studied extensively as a single ingredient and in synergy with other ingredients. This was one particular study here that looked at the acetylglucosamine, so neoglucosamine, providing fast reducing benefits and mildness, demonstrating the potential utility and enhancing conventional prescription all over the strength acne treatments. Okay? So if I can draw your attention to the individual down here, which I appreciate may be a little difficult to differentiate, trying to treat acneic skin, I think in phototypes of 3 and above can be exceptionally challenging, because I think there is the worry that by being too aggressive in your treatment modality or treatment regime, you may initiate a post-inflammatory problem. But it's interesting, a lot of the studies that the Neostrata company have can be focused on the Caucasian skin types from 1 to 3, and this is one of the studies that included darker skin types. And they found that actually the reduction in lesion count was notable, and the overall anti-aging effects of what this neoglucosamine can do were profound in terms of producing and synthesizing natural hyaluronic acid within skin. So whatever other ingredient this is formulated alongside, the anti-aging benefits are still there. So when we treat our acne patients in the Refine range, we know we're not just treating the active signs and symptoms of what they have, we are also giving them anti-aging benefits as well. And the same is true when we think about this ingredient in the Enlighten segment. We're not only giving them endogenous production of the skin's natural hyaluronic acid and therefore a plumping and firming effect to the skin, but we are also inhibiting the tyrosinase and treating their pigmentation and giving them a gentle exfoliation at the same time. So this is truly multi-mechanism in my perspective. And again, derivatives of sugar compounds provide anti-aging effects. The study was also showing the same effects as well. Total skin thickness here with digital caliper measurements and pinch recall and elasticity almost up by 12.5%, and again by 15.5%. This is probably one of my favorite ingredients actually in the entire Neostrata portfolio. Here we have a novel tyrosine amino acid derivative in a topical wrinkle filler. Now, I'm mindful, obviously, this is an ingredient that we're going to see a lot of now over the next few days, and quite deservedly, because I think this is a very new, exciting treatment horizon for what we can achieve with plumping of the skin from an amino acid derivative. And the ingredient that I'm talking about here is Aminofil. Who's tried the Tri-Therapy Lifting Serum? Yeah? Brilliant.
For 2 weeks now.
Do you like it? Brilliant. Yeah, it's fantastic. Okay, so we're going to hear a lot more about that. Okay, certainly later on this morning and throughout the next few days, but it's a very exciting horizon because obviously one of the core ingredients we have within this exciting new product is this. Okay, we also see this ingredient in terms of its pro-collagenic properties. It makes itself known within the resurface segment in our daily peel pads. So we have a product within the resurface segment which gives a beautiful exfoliating effect with 10% glycolic acid and also has 0.5% aminophyllin as well. So we can actually go above and beyond even the more sort of superficial exfoliating effects we've seen with glycolic, we can actually achieve a neocollagenic effect and a true anti-aging effect here. All right, and let's look at that in a bit more detail. These are some of the nicest histological slides I think the Neostrata company have. On the untreated side here, okay, we have just the light blue colloidal staining compared to here where the staining is much deeper and much richer, showing the increased amount of hyaluronic acid in the skin. Just at 8 weeks though, that is a record turnaround time for a topical ingredient to stimulate that kind of biological effect within the skin. I think the bottom two images are even more exciting. We have just some very, very faint browning here. You can just see the dermo-epidermal junction here on the left-hand side, but an increased quantity of that from the right-hand side here. And that's actually pro-collagen formation at the dermo-epidermal junction. It's phenomenal, just at 8 weeks. And this is the novel tyrosine amino acid, the aminophil. And this ingredient, which many of you may know as well, also makes itself known within the retinol peel. Who's used the retinol peel? How good is the retinol peel? It's my favourite peel ever, 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 ever. I love it, absolutely love it, okay? Dynamite combination, we're gonna come back to that and look at some case studies with that as well this morning. So multi-purpose, multifunctional, working beautifully alongside other ingredients, but just on its own, this is what it's capable of achieving. Here it is, my favourite peel. If any of you wanted to read, obviously we're going to look at some case studies for retinol peel firsthand this morning, but this was a case study that we did last year, looking at the facial peeling using the retinol peel, and that subject that we used in that study actually had no concurrent Neostrata skincare, so this was literally just the effects that we wrote up in this study from the peel, which is exciting. So we've focused very strongly this morning, well, so far at least, on the effects of what single ingredients can achieve. I mentioned that the neoglucosamine has an exceptional effect in so much as this can actually amplify and accentuate the synergy and the effects of certain other ingredients that it's combined with in formulations. So if we think about retinol for a second, we know that retinol promotes epidermal thickening. Again, it can decrease the effect of MMPs. Very effective sort of global overarching anti-aging ingredient. It's very, very popular in skincare. Increases fibroblast growth, and there's a comparison to retinoic acid for photoaging with reduced irritation potential. Those are two studies there, for example. There's a lot of other data out there to show the tolerability per se of retinol is favourable as an ingredient, okay? So retinol, just as a little bit of background, I think our colleague Dr. Stephanie Williams is going to revisit this in more detail, but what we have to be mindful of is that retinol needs to be converted to retinoic acid intracellularly, okay? And it does that by being converted to retinaldehyde and finally to retinoic acid, all right? So that's an important concept to keep in mind, because what we have here, for those of you that may be familiar, may be using or selling this product already, for me this is my nighttime product, from the Skin Active range, we have a retinol and NAG complex here, and this is a true synergy and an incredible effect of what these two ingredients can achieve. We know what they do separately, no question, but you bring them together, you get the most phenomenal production of hyaluronic acid within the keratinocytes within the epidermis. You get more of a hydrating and plumping and firming effect, in essence, than if retinol was to be used on its own. The other advantage of this formulation means that we can deliver a potent, high-strength formulation of 0.5 retinol in a microcapsulated polyporous system. So you don't get the surface irritation. You don't tend to get the redness and the dryness that you would do with maybe some prescription strength retinols, for example. And the time-release microencapsulated retinol means we can maximize our potency and tolerability, okay? This product you may choose to use on its own. You can layer other nighttime products on top of this as well. And this is particularly nice if it's mixed with one of our other nighttime options from the Skin Active segment, the product which we've alluded to this morning already, that also contains malturbonic acid, which is dermal replenishment, okay? And that's really the icing on the cake in terms of one of the ultimate nighttime regimens, particularly for photo-age skin. Even acneic skin, we know, responds beautifully to the overarching effects of what retinol can achieve. So in the words of Carly Simon, who's a great, I'm a great fan of, In my view, with 30 years worth of formulation, which I think is going to be the theme that Marissa's going to take us through, which I don't think anyone does it better than Neostrata.